Hello, and welcome to the Neurocritical Care Society podcast. I'm your host, Dr. Nicholas Morris from the University of Maryland School of Medicine. And today, as part of our Hot Topics series, I'm really honored and excited to welcome our guest, Dr. David Greer, to talk about some new developments for the Neurocritical Care Society Brain Death Determination course. By way of introduction, Dr. Greer is professor and chair of the Department of Neurology at Boston University School of Medicine and the Richard B. Slifka Chief of Neurology at Boston Medical Center. He's also the vice president of the Neurocritical Care Society and a leading voice worldwide in death by neurological criteria. He was the lead author for the World Brain Death Project, the 2023 AAN Practice Parameters in Brain Death, and helped create the NCS Brain Death Toolkit and the NCS Brain Death Determination course, which we'll talk about today. I'm very excited. He's been a mentor and a friend, and to have him on the podcast is really an honor. Dr. Greer, welcome to the podcast.
Great. Thanks, Nick. It's so great to be here with you.
Well, today I think, we really wanted to talk about brain death and in particular about the new in-person brain death determination course. But I've always wanted to ask you, how did you get interested in this topic to the point where you've dedicated so much of your time to really studying and helping educate others about brain death?
Yeah, it's a great question. And I'm not entirely sure, but I think it kind of stems back to early in my career when I was really interested in end-of-life care, disorders of consciousness, and this really being on the far end of that. But if I could pin it to a particular instance, it was when I first was determining brain death in a different hospital from the one that I trained in, and they had a different policy and protocol. And I thought, well, that's just weird. Why would there be different policies for brain death? I thought brain death was brain death wherever you were. And that's when I started studying it and saying, oh, but gosh, there's a lot of variability out there and we got to do something about it. So I'm a bit of a crusader. And I've been on a crusade ever since then to make sure that we do brain death right. And having good hospital policies is part of it, but doing, courses like we're going to talk about today is another really big part of it as well.
Well, thanks. I think you've certainly led the way in highlighting a lot of the variation in practice in brain death and the need for further education. And as part of that, you helped several years ago develop this NCS Brain Death Determination course. Can you tell us a little bit about what inspired the development of that course and how it's going so far?
Yeah, I think if you're referring to the one that's online that we've had for many years, I think that's been a really good addition. We've wanted to have something that was akin to the American Heart Association BLS guidelines, where you kind of walk through different scenarios and showed your knowledge base at least as much as you can online. And hopefully that was really a helpful addition to the Brain Death Toolkit, which I know we'll talk about a little bit as well. But the course online really is semi-interactive, and it includes some didactics, but also some scenarios that you have to work through and some quizzes. But it's the only course that really provides a certificate of sorts. How valuable that certificate is under some debate, but it's the only certificate you can get, and it is a rigorous course that you go through. And I can tell you that worldwide, people really do want to get certified in this, and they've used it quite admirably. And that gives us great pride that we're not just a U.S.-based operation, but people worldwide are seeing the advantage of the training like this. And that was really the goal, right? Is not everybody can do an in-person course or a work with a mannequin. And we want people in lower resourced areas to be able to have access to a course like this and get training and certification. And that's exactly what's happened.
Great. And I think we sort of touched on this before, but why is it so important that certification exists for brain death determination?
Well, certification exists for other things. And I think in our field, people really want to have a documentation that they have gone through some kind of a rigorous training. Do I think that this is the endpoint for certification? No. Could we potentially partner with other organizations beyond NCS, including maybe AAN or SCCM, to really put a larger stamp on it? I think that would be a really great goal for us to do. But people like certificates, and hospital administrators like to see certificates. And you can say, well, we are expert in this and we should be the ones doing this. And I personally don't care if it's a neurointensivist or a general intensivist or a general neurologist. I just want whoever's doing it to be competent. I want them to know what they're doing. And so this is one way probably not the last way, but one way that people can get the training that they need and have some kind of a certificate that might be meaningful for them.
Great. So I think that's an important point. So if I'm correct, it doesn't have to be a neurointensivist. You don't have to be a neurointensivist to take the course. That's not a prerequisite. And in fact, the course is online through the Neurocritical Care Society website, but even non-members can take the course. Is that correct?
That's correct. There is a cost associated with it. I don't know what that cost is, but it is available to anybody online.
Excellent. And you mentioned the Brain Death Toolkit, which is also available online. How is that different from the course?
Yeah, that provides a lot of different resources. It gives you, some basic links like to the most recent guidelines, so they're readily at your fingertips. We do have the e-tables from the guidelines and the clinical tools that were provided by the AAN with that. But we also included things like a sample brain death hospital policy that you could just, it's modernized. It has everything that you need to be congruent with the new guidelines. So all you have to do is put your hospital name on the top of it and you're good to go. We have a sample brain death policy checklist, which again is entirely congruent with the guidelines. And so those are just making things easy for people. We have FAQs, both for healthcare professionals and for the lay public, because a lot of common questions come up. And if you've seen them before, you have some idea about them, they can be really helpful for you. And then there's the webinar that's a recorded webinar that goes, kind of soup to nuts through everything. There's a New England Journal link that goes to a mannequin 5-minute video, which is really helpful for people also, that you can just watch it for 5 minutes before you go in and do an exam as a refresher. And then the last thing is the training and certification course, which takes about an hour or so, a little bit less actually.
Great. Well, here at Maryland, we recently redid our brain death determination policy, and we certainly used some of those resources, and that was very helpful. So I really appreciate those. Now, NCS is in the process of launching a new in-person brain death determination course. You had mentioned that the online course is fantastic and widely available. So why do we need an in-person course? What's the advantage of doing the in-person component?
Well, I think what's unique about the in-person course is that you get to have hands-on training with a mannequin directly supervised by somebody who's an expert in it. And we put you through a couple of scenarios where it's not straightforward. It's close, but there are a couple of things that you have to navigate. Like, is the patient's temperature okay? Do they have drugs on board? Do they have neuroimaging that is compatible with brain death? And so you got to kind of know your stuff a little bit. We'll throw a little DI in there and make the apnea test a little complicated. So I think that that's really helpful. And then there is a didactic session that is about an hour-long lecture that goes over adult and pediatrics and goes over videos. There's always a huge question and answer session with this. A lot of people want to be able to ask questions. Well, what about this temperature thing? What about a pregnant person? Why did you guys do this? And what was the reasoning behind that? And I think that that's really helpful because if people, don't quite understand why the guidelines are the way that they are, they can ask the question and get the answer and make it make sense to them. Then I think that helps them to feel comfortable with that are doing the right thing. I have to emphasize when we created the guidelines, the biggest number one goal for us was making sure there was no false positive determination of death. The worst thing that we can do for the field is have a person go for organ donation and take a breath or have a corneal or move. So we can't be wrong about this. And so an in-person course is super helpful. The last thing that helps with the in-person course is that we do some family communication part at the end also and get people to practice. And we'll give a scenario where everything goes well. And we say, why did that go so well? And then we'll go give a scenario where things went bad or wonky. And they're like, yeah, I would have done this differently or that differently. That's been a really nice addition that people have really found very helpful. And we only added that in the last couple of years.
Great. I think that will be incredibly important. And that's a part of the brain death determination that I think is overlooked by many, particularly perhaps outside of neurology. And yet often that's sort of the key place where things can go wrong is in that family communication. You mentioned the hands-on component going through the exam. I'm interested in your experience. What are some of the common errors that people make actually in doing the exam, which to many of us seems fairly simple? It seems like this should be almost a no-brainer. But what are some of the pitfalls that you've seen?
A great question. So I'm kind of a stickler, and Nick, you know that from working with me for many years, but the corneal test is super important and people will often not test that properly. So I always emphasize using a a Q-tip or a cotton tip applicator and actually pressing on the eye and watching it move. And people are usually too far out on the sclera. The farther you get away from the iris, the less sensitive the eye is. So it really should be tested at the border of the iris. I would say that
And
the
if I can
oculus,
interrupt,
yeah.
Dave, that's not just your own finding, but actually you've published on that, right?
Yeah, we did a publication in the Neurocritical Care Journal. I think Carol Maciel called it the Ode to the Corneal Exam, which was great. It's a perfect name, and Carol's really helped to lead this field also. Another area is the oculocephalic, that we really want people to stabilize the endotracheal tube as they do that because you can dislodge it, and that's not so great. And then the oculovestibular, the cold calorics, putting the head of the bed up, looking in the ear, making sure that the canal is open. Those are kind of key steps that people need to do that often are done wrong. And so that's why having somebody at the bedside. And then I remember one instance at a different hospital that I was working previously where a patient was in a cervical collar, and the person who examined them first checked off that they did the oculocephalic. I'm like, oh, really? How did you do the oculocephalic? Did you take the collar off? It's like, oh, no, of course not. I'm like, okay, let's move on.
Okay.
Yep.
That's great. I think walking people through those components of the exam and making sure they're doing them correctly is going to really be a good step forward for the course. I'm wondering, when can people expect to find this course and where? How are they going to do their in-person training, perhaps after they take the online course?
Yeah, this year we're probably going to roll it out regionally in about 4 or 5 sites. And we're not entirely sure of the timing yet, but it'll probably be Boston, Texas, LA, Pittsburgh, Florida this year, some combination of that group, and hopefully Maryland very shortly thereafter as well. I know you've had a great interest in this and will do great with it. So we're still working out the exact dates for this, but we will definitely try to advertise when it's going to be in your region. And the long-term goal is to make it like ENLS, or maybe even attached to ENLS, so people could do both of those courses and really spread it out and have the teach the teacher, train the trainer type of exercise for this. So this year is the rollout for 4 or 5 sites, and hopefully next year we'll get it really going nationwide and worldwide. We've done this course in the UAE 2 or 3 years in a row now, and we've trained over 600 people. So it's been very popular in the UAE, and so now we really need to do this in the US, and we know we can.
That's wonderful. Any efforts to add this onto the annual meeting?
Yeah, so we've had it as a workshop previously, and we were supposed to have it this past year, but there were some, I'll just say, technical difficulties that it didn't come through. But I think it really should be a staple of the annual meeting as a workshop. I have to be careful because I'm planning the annual meeting this year. I don't want to play favorites and say we've got to do brain death because that wouldn't be fair. But I do think that we should be able to work it out that that's just a staple, kind of like the ultrasound course is a staple every year. I think we should have brain death there as well. I mean, who better than NCS to own this, right? This should really be our thing.
Absolutely. And as this rolls out sort of slowly at first and picks up steam, if people want to bring it to their own institution, how would they go about doing that?
Well, I think they could just reach out to me and I'd be happy to talk to them about how to set it up and do the scenarios. I don't mind traveling to some places to be able to help them and train them. So at this point, I'll offer myself, but I think over time, as we have more sites that are up and running that are have done this and we have more experts that can do this, then we'll probably have a more formalized way through the NCS website to do it. But for now, just reach out to me directly, dgreer@bu.edu.
Excellent. There it is. As this moves us forward, what more do you have in mind that you see as necessary for brain death education, both in the United States and beyond?
Well, I think I'll toot your horn for a second, Nick. I think the work that you're doing around simulation and brain death is very important, and getting our trainees to learn how to do this the right way. I didn't learn it well during residency. I remember being told in the middle of the night, "Well, go in there and test them for brain death and call me back and let me know how it goes." I mean, that was my training.
Yep, yep.
I think we're doing a bit better with this now, but we have we have to train the people who are currently doing it to make sure they're doing it right. But if we invest in the residents and fellows, then we don't have to do this so much down the road. If people get good training in the residency and fellowship, then that gives them the backbone that they need. So I would tout your work, Nick, that you're doing along with Dan Harrison at My Joint and multiple others that I think is going to be very important. I'll also call out Sarah Wallster, who's done really great work in this space. And so there are a lot of really fine people who are very dedicated to the education around this. And I applaud your efforts and I support them in every way that I can.
Thanks. That was very gracious of you. I wanted to point out we had our fellowship clinical competency committee meeting yesterday, and brain death is a milestone that we need to rate our fellows on. And we had first year fellows, and one of them just in the first 6 months of fellowship, they hadn't done a single brain death determination. It just happened that way. And the other junior fellow, we learned, had one opportunity as a fellow, but had not done one as a resident. And of course, brain death determination is part of the ACGME milestones for residency as well. So the opportunities are not necessarily out there for all trainees to do this in real patients during their training. And we really have to find adjuncts in order to make sure that I think people are competent when they finish their training. So the NCS course and anything else we can do, hopefully will go a long way into ensuring competence in brain death determination.
Well, can I comment on that for a second? So one thing I think we can do when we have a real live situation, which is kind of an oxymoron here, is to go to the resident workroom and say, hey, we're going to do a brain death exam. Hey, we're going to do an apnea test. And make sure that you get that crowd of people, unless the family's there watching, which is obviously sometimes the case and can be very intimidating for them to have 10 or 20 people in the room watching this kind of thing. But if the family isn't there, making sure that the residents and fellows know that it's going on so that at least they can observe, and letting the fellow do the exam in front of the attending. That's perfectly acceptable according to the guidelines, but the attending just needs to be there to make sure everything's done correctly. They don't have to do it themselves. So it's an important nuance that people need to know about.
I think that's a really good point. And any last words we should give our listeners about the NCS course?
No, but I hope that people take it. I hope that people enjoy it. And I hope that you give us your feedback, because we want it to be useful to you. We're here to serve our members. And if it's missing something or if it's off base in some way, we'd love your feedback. So please let us know as you do take it, to let us know how we can make it better.
All right, thanks. Dave, this has been wonderful. Thank you so much, not just for all of your hard work in moving the field forward, but also for your personal mentorship. I've really appreciated it and cherished the time you spent with me and our larger group that's working on improving brain death determination training. It's been a pleasure to host you on the podcast. This is the NCS podcast. I'm your host, Nick Morris, and we hope you tune in to future episodes in 2025. This was the first of the new year, and we're really excited for what's coming next. So please subscribe and like, and we hope to have you back on the podcast soon. Thanks a lot, Dave.
Thanks, Nick. Take care.